In this episode, we're going to talk about some things that you use in your practice every single day and some things that might change the way that you perceive it.
In this episode, we'll discuss fluorescein dye and why its utilization is so important in our practices. Fluorescein is a hydrophilic molecule, and clinically it's available on a fluorescein strip. We moisten that strip with a few drops of saline and then apply it to the eye. And we visualize it on the ocular surface with a cobalt blue light and a Ratten filter, which can be seen here. Now, we've typically reserved the use of fluorescein for symptomatic patients, like the one seen here. In this patient who presented with herpetic epithelial keratitis, fluorescein helps us not only diagnose these patients, but also allows us to follow these patients over time and monitor the clinical consequences of treatment. But if we only utilize fluorescein for symptomatic patients, we may not be seeing the whole picture. As we know, in dry eye disease in particular, clinical signs don't always correspond to symptoms. In the top left, you can see a patient that presented with no symptoms but has a significant amount of inferior corneal staining. In the bottom right, you can see a patient who only has mild symptoms of discomfort but has significant area of cornea that's occupied by fluorescein staining. In each of these next patients presented, they each presented to the office with complaints of reduced vision. Without utilization of fluorescein, the irregular areas of elevation seen as hypofluorescence just simply aren't visible. Only with the use of fluorescein are the irregularities truly evident, and the patient's reduced vision can ultimately be explained. It begs the question, are we seeing the whole picture if we aren't using fluorescein? This is extremely important to consider when assessing the tear film. Although there's variability in the literature, a tear film breakup time that's greater than 10 seconds is usually considered normal. Unfortunately, unless fluorescein is utilized to assess the ocular surface, this just simply can't be appreciated. In each of these cases, the tear film breakup time, which is the time from the blink to the first area of visible hypofluorescence, is severely reduced. When you contrast the view of the tear film with fluorescein, cobalt blue light and a Ratten filter compared to a standard slit lamp evaluation, now visible on the right-hand side, you realize that without fluorescein, this abnormality just can't be clinically appreciated. This is critically important when you consider the effect that decreased tear film integrity can have on the ocular surface over time. It can cause things like transient blurred vision with blinking, symptoms of discomfort or uncomfortable eyes. In some cases, it can even cause refractive instability, and when left untreated, can lead to things like corneal compromise. Because of all the conditions that can easily be seen with fluorescein, we recommend considering incorporating this into every patient encounter. It'll help uncover ocular surface conditions that are virtually impossible at times to see without the dye. And because a healthy ocular surface is critical for optimal contact lens wear, we feel that this will improve visual and ocular health outcomes for patients, which is ultimately why we do what we do.